infection, if it is not resolved, will lead to scarring of the liver. And the scarring of because chronic hepatitis B and cirrhosis are really quite silent phenomena. Patients may not be aware that they're having inflammation or cirrhosis. And when you have cirrhosis, then you have the possibility of getting complications, such as bleeding from the stomach, called bleeding esophageal varices, or the esophagus rather. Decompensated liver disease, which means the liver's function starts to decrease, and then there's a buildup of water in the stomach. You may get jaundice, and of course it increases the risk of liver cancer with an early possibility of death. Now, let me bring some simple principles about hepatitis B virus to you. So the hepatitis B virus is a virus that contains genes, just like chromosomes contains genes. And when these genes are working in the body, they need to be able to be converted into proteins. The proteins are the ones that lead the virus to be able to multiply and to spread. And so there's a process called transcription, where the genes convert into a messenger called RNA, and this messenger gets translated into proteins, amino acids. So the starting point is always genes, all right? And these genes, when they're compressed together, they form a chromosome. Like your body has chromosomes, and these chromosomes contain genes. They're bounded together by proteins called histones, and these proteins basically create the structure of the chromosome and bind it together. So this is how the hepatitis B virus works in the human body. So you can see here in this schematic diagram that it contains a shell, and in green here, the outer shell called the envelope, and an inner shell called the capsid. And it contains the inner core of the DNA, which is a viral gene. It's not a very long gene, it's only 3.2 kilobases. And when this virus enters the liver cell, it releases the gene into the nucleus. So the gene enters the nucleus, and the nucleus then forms these things called cccDNA, which is basically a chromosome. So it uses the proteins from the nucleus, the body's proteins, to form a chromosome. And you can see that chromosomes are very difficult to remove, so they can stay there for a long time. And this gets converted into RNA, the messenger, as I told you about, the pregenomic RNA, and this gets translated into proteins. So the proteins are made by the virus, such as the X, the core, the E antigen, S antigen. And then it also starts to form the core particles here. The proteins also form core. And this basically is the inner shell of the virus. And then the DNA of the RNA that gets converted to the DNA. And finally, the virus gets assembled in the endoplasmic reticulum called the ER and gets secreted again. Now, this is a somewhat complex life cycle, and I've taken you to this because we need to understand a little bit about this before we understand how the drugs work against hepatitis B. So there are overlapping pathways, and I've simplified into two basic pathways. This is called the replicative pathway. The replicative pathway is what the virus uses to multiply, right? And then there is something called the secretory pathway. The secretory pathway is where the virus produces proteins, some of which are used in the replicative pathway, but there's also a lot of proteins that are secreted. Now, I should highlight that this thing called S antigen, which is the outer capsule of the particle, the envelope of the particle, is secreted in far in excess into than active virus. So there are a lot of empty particles here, and the job of these empty particles is basically to paralyze the immune system and to prevent it from being removing the virus. So there's far excess, probably 1,000 times in excess of these empty particles compared to the active particles. Now, what's important is that drugs I'm going to mention later, the active drugs which we are using today, nucleoside analogues, actually work on the replicative pathway, and capsid inhibitors, which I'll mention later, also act in this pathway. While if we want to cure hepatitis B and remove S antigen, we need to block the secretory pathway or prevent the virus from producing any more proteins. So this is just a simple way to understand how the virus replicates and how the drugs need to work on different pathways in order to be active. So replicative pathway markers are HBV DNA and HBV RNA. And the secretory pathway is the S antigen level. So as I mentioned earlier, when the virus gets infected into a child at birth, it doesn't damage the liver. The very high levels of virus and the liver looks perfectly normal. So the damage to the liver is actually done by the body's immune system. So we know that when the immune system is not effective and does not recognize the virus, shown here in green, there's viral persistence and exhaustion of the immune system with very high levels of virus, shown by this schematic diagram. At the other end of the extreme, in blue, when the virus is controlling the liver, then in fact you can the body's immune system can clear the virus. Now, somewhere in between, when there's immune activity but is not able to clear the virus, you get pathology, and that's where you get liver damage. So moving on to what is cure and why do we need it? So cure is defined as sustained S antigen loss, 24 weeks after treatment. And if we're doing research and we're doing clinical studies, we want to see roughly at least a 30% effectiveness before we can believe that this is something that's quite effective. Now, the current drugs have important limitations. They rarely cure hepatitis B, and they don't always stop the disease in everybody. And these drugs need to be taken for life. But if we can get cure to hepatitis B, it can lead to big improvements in liver survival and reduction in complications, as I'm going to show you. So the benefits of cure are listed here. There's a 78% reduction in death rate. That's an almost 80% reduction in death or liver transplant. Liver failure is reduced by 70%, and liver cancer is reduced by 70%. So this leads to an incredible benefit for patients if they can achieve hepatitis B cure. But today, unfortunately, the drugs that we use are not particularly effective. These are some of the current drugs that are approved for hepatitis B. Entecavir, baraclude, Viriad, or tenofovir, and Vemlidy, or tenofovir alafamine. These require taking 1 tablet a day. They're very safe with very few side effects, but the chance of a cure is less than 1% a year. So long-term treatment seems to be necessary. Another treatment is interferon, shown as this in this slide on the right-hand side. You need to take it as an injection and as one injection per week, and you need to give it for about 48 weeks or about a year, roughly speaking. There are many side effects, and 10 to 20% of people can't tolerate it. They have to stop treatment. But the chance of cure is somewhat high, 5 to 10%. Now, that's why we need new treatments to try and achieve cure. And there are 3 strategies to try and reach this goal. The first one here on the left is inhibit replication. I've already shown you in that pathway, inhibiting replication doesn't really deal with the pathway of the secretory antigens. So the second strategy is to lower the viral antigen burden, and that deals with the pathway to reduce antigen secretion. And the last one is to boost immune responses to try and clear. And there are, you can see in the bottom panel here, there are drugs that are each category that I will discuss as potential treatment strategies moving forward. So let's start with inhibiting viral replication. And there are 3 classes of drugs here. There's viral entry inhibitors, there's inhibitors of viral replication, and those that inhibit capsid production. So what are these drugs? So This one I've already told you about. This is the nucleoside analogues that we are already approved for therapy and that most people are on for treatment. You can see here, this is the level of the S antigen or the envelope protein. And over a 5-year period in this study, there's very little change in this S antigen level. You can see that in this A, B, and D, there's a few patients who did manage to respond very well and achieve S antigen loss. But I said, generally speaking, it's about less than 1% a year. And it is believed that you need to take these treatments for around 30 to 40 years to achieve S antigen loss. However, they are very safe and they're very easy to take. So that's a real benefit of these nucleoside analogues. Now, this is a capsid inhibitor that is being used in an early stage trial. And I just want to take you through the results here in this graph so you can understand what it is. As I said before, in my earlier slide, the DNA and RNA blocks the replication of the virus, and this drug, a capsid inhibitor, blocks the replicative pathway, and it's very good at it. You can see here that there's a tremendous reduction in the levels of the DNA and the RNA, but the secretory pathway, the S antigen, there's only a small reduction in that. So hence, this is very similar to the nucleoside analogues that is already approved for treatment, but the safety of this drug seems to be quite good in early phase studies. Now, one of the other drugs I mentioned here is an entry inhibitor. It blocks the virus from entering the liver. Now you might say, well, what good is that? The virus is already inside the liver. How does blocking the virus from entering it help? Well, in the life cycle of the virus replicates and can reinfect cells that do not have the virus. So it may block the virus from spreading throughout the liver in the lifetime of a patient. In this study, where Mercledex was given alone to patients, we can see the level of S antigen was quite flat. There was no change in the secretory pathway, but this was done in patients who had infection with hepatitis B and D, or Delta Asian. Hepatitis D is a virus that sometimes infects patients with hepatitis B. So this is a double infection. But nonetheless, when we look at the effect of hepatitis B, there doesn't seem to be any change in the level of the outer envelope or the S antigen. So moving on to the second category, lower the viral antigen burden, we can reduce the E antigen and the S antigen by this method. And there are two drugs that do this in this category. This is something called RNA interference and blocking the release of the S antigen. So what is blocking RNA interference? So here I just have to do a bit of explanation. Basically, this is a drug that consists of nucleic acids that recognize the hepatitis B DNA. So basically, they're complementary. So it is designed so that it will specifically identify the DNA of the hepatitis B virus and bind to it. So but it has to be given by injection as a weekly or monthly injection. And you can see that it will enter the virus and then enter the nucleus and attach itself to the virus. And you can see in this graph that there's a very nice reduction in the S antigen level when this drug is given. So in one study, 25% of the patients lost the S antigen after 3 to 6 injections. And this type of treatment, RNAi, has been approved for use in rare genetic disorders such as amyloid, porphyria, and primary hyperoxaluria. So it's already been in use, but it hasn't been in use for hepatitis B, and they're testing it to see whether it's effective. Now, the second group of drug in this category is blocking S antigen production. And this is called nucleic acid polymers. And you can see here in this drug that was given as a weekly infusion, There's 25% of patients had a sustained response. You can see here in this dotted line here is below the detection limit. So there's a few patients who actually achieved S antigen loss. And you can see in a similar way, there was a reduction in the production of the replicative pathway, the virus DNA. What about boosting immune responses? What can we do to help here? Well, this is a slightly complicated slide, but the immune system is a very complex thing in the body. Obviously, it clears infection, such as COVID, for instance, these days, but also other viruses and bacteria. And there are two types of immune responses that in the body. There's the innate immune responses, which is more immediate, and there's the adaptive responses, which take a little bit longer because they rely on memory. Memory of the B cells or memory of the T cells to come and attack the liver. So if you can boost responses from these two groups of immune responses, we may be able to clear the virus, as I told you, that these immune responses may be very useful in clearing the virus. So this is in the left-hand panel, this is innate immune stimulation using TLR8 agonists. And in this study, which is a phase 2 study, after 48 weeks, about 5% of patients lost their S antigen. So some promise here that there's got some activity. And this is a drug, nivolumab, that's been used in cancer treatment. It's a checkpoint inhibitor, and it boosts the adaptive immune response. And you can see here again in this short-term study done over 12 weeks, about 5% of patients lost antigen. So I think in principle, these two approaches can lead to clearance of S antigen. Now, clearly I've shown you those drugs being used as individual treatments. So the big question now is, can we combine them all, and which combinations are going to be useful? This is quite a complicated slide, but I just want to remind you that this is what people are now investigating, which combinations are the best. And let me take you through some combinations which might be useful. So I think I showed you about the entry inhibitor, and now we're going to use it with interferon. This is Mercledex, which I showed you. Used alone, didn't have much impact on the S antigen levels. And this is interferon. Now, even though interferon leads to 5% S antigen loss in this study, there wasn't much effect on the S antigen levels. But when you use them in combination, surprisingly, something amazing happened. About 26.7% of patients lost their S antigen. The main problem, you need to use interferon, which has a lot of side effects, and you need to use it for a year. 10 to 20% of patients can't tolerate it. But nonetheless, some promise here that this combination could be effective. Now, this is the S antigen secretion blocker, also called REP. And they use this in combination with nucleoside analogues, which we already is approved for treatment, and interferon. Again, interferon is being used in this study, and it seems to be quite an important drug to achieve S antigen loss. And this is a slightly complicated slide, but I just want to highlight here in green, every time you introduce REP, so they use a combination of tenofovir, which is the nucleoside analog, interferon, or REP, which is the S antigen secretion blocker. So every time they introduce the REP, you can see here in green, there's a dramatic reduction in the S antigen levels in the first arm of the study. In the second arm of the study, they introduced it a little bit later. And you can see in green here, there was a rapid drop in the S antigen levels. And again, the DNA levels also were reduced because they were both given tenofovir as well as interferon. So very promising. 40% of patients lost antigen, but unfortunately, again, you need interferon and nucleoside analogues. So this is now the latest combination using nucleoside analogues, which we already have approved, the capsid inhibitor, and the RNA inhibitor given as 3 injections. And you can see here, there's a steady reduction in the S antigen levels over time. The DNA reduced by 8 logs, the RNA reduced by 7 logs, and S antigen declined by almost 2 log. So this type of combination looks very promising as a strategy to combine drugs to achieve hepatitis B cure. So just to summarize what I've been telling you about, so basically you need drugs that block the virus, reduce the virus, viremia, reduce the antigen load, and remove the virus, or to silence the virus chromosome, mini chromosome inside the nucleus of the cell. At the same time, boost immune responses either through innate immunity. Humoral immune responses are the antibodies, and the T cell responses to clear the virus. So just to conclude, the goal is hepatitis B cure, which leads to a 70 to 80% improvement in survival and reduction in liver cancer. Existing drugs are limited in achieving cure, but there are many new drugs in development, and combinations then already show promise. You're hopefully able to see a strategy emerging within the next 5 years. Thank you very much for your attention, and I'll be happy to take any questions.
Seng Gee, thank you so much for that presentation. We're deeply grateful. There has been a couple of kind of questions that have come up in the chat box, and please, any people attending, feel free to type into the chat box. In terms of cure, you have just been talking about loss of surface antigen as opposed. Can you kind of define what it is that you mean by cure?
Okay, so there are a number of ways you can define cure. What I've been discussing is what we call functional cure, and I did not try and differentiate that from absolute cure. So absolute cure means that you remove the cccDNA from the liver, and you remove integrated virus from the host DNA. This is going to be very difficult to achieve, and in a way, maybe it's something that is not going to be achieved in the current drugs and tools that we have today. But for all extent purposes, we don't need to be as concerned about absolute and functional cure, although that's something ideal, because if you have functional cure, the chance of having the virus return is extremely unlikely unless there are very specific circumstances. If you have heavy immunosuppression, for instance, for chemotherapy, for some sort of cancer treatment or autoimmune disease, there's a likelihood of reactivation of the virus. But if you don't have any of those situations that develop, then the chance of the virus returning is extremely uncommon. Now, the biggest question, of course, is cancer, liver cancer. So some patients can develop liver cancer even after they've cleared hepatitis B, they've lost S antigen. And that event, of course, is greater if at the time you clear the virus, you have liver cirrhosis. So if you have liver cirrhosis, cirrhosis itself is a predisposition for liver cancer. But if you don't have liver cirrhosis, the chance of having liver cancer is actually relatively small. I think studies have done that, and they found that the chance of that is something like 10 to 12, 100,000 in the lifetime of a patient. So it's really not a common event. So for all intents and purposes, we should focus on cure and try not to think about, oh, well, is the virus totally gone or is it partially gone? Because at the end of the day, what we want to see is, well, what's the benefit for the patient in terms of reduction in cancer, reduction in survival?
So is using the term cure the right way to do, to kind of conceptualize what it is that you're doing?
I think it's a great way. I know that there are lots of people who would technically disagree with me, but let's not split hairs, right? You know, I mean, a lot of my patients want to hear a cure. They don't want to know, is it functional cure? Is it partial cure? Yeah. You know, am I cured? Have I got, Because it's the stigmatization, right? They don't have hepatitis B surface antigen, so they're no longer hepatitis B carrier. They're absolutely delighted with that. And I do inform them that there's still a possibility of liver cancer. So we need to monitor you. We need to you know, be sure that there's a low risk of any problems occurring. But in general, you know, you can go and do whatever else you want to do and lead a normal life, and don't need to worry about the fact that you've got this virus that's going to lead to some, you know, flare up of hepatitis. And you can stop treatment. That's that's I think they really want.
Listen, thank you so much. There are like a range of other questions coming up, which is kind of a reflection of the kind of need for more information and a willingness for people to kind of engage with this issue, particularly people with hepatitis B. I'm not sure what I can do with the questions because we do have a limited amount of time, but we will kind of keep in, we'll record all of the questions that we have and somehow put them either on the CEVHAP or ICE HBV site, just as a kind of indication of what people are thinking and what are the kind of issues that people want answers about. So Seng Gee, thank you. Deeply grateful for your support and presentation.
You're very welcome, and I'm delighted to participate.